Hi everyone, I'm Jorge Florez from Global Integrity, and today we're here to talk about the COVID 19 Transparency and Accountability Project. This is a project that has been implementing in 9 African countries, and we have two of the main leads of the project, Iyanu from BudgIT Nigeria and Mukhtar from Connected Development. They both have been great in supporting the partners and in carrying out the work in Nigeria. So I'll basically give the word to them because we want to hear from them what they have learned, what they have seen, and all the things about the project. So I'm gonna just quickly give you a word, guys, so you can introduce yourself. So please, Ijanu.
All right. Hi, everyone from every part of the world where you could have been watching. Thank you very much for joining us. And basically, this conversation is to introduce the COVID Transparency and Accountability Project, which is called CTAP for short, that has been running across 9 countries, basically strengthening our response to resource management, epidemic preparedness, and also understanding how vaccines have been democratized under vaccine hesitancy and also vaccine equity. So basically, for us, this project has given us an opportunity to understand, how to strengthen health systems across Africa, and also basically how to contribute our own quota as civil society organizations into making sure that governments across these 9 countries understand what needs to come into play as towards ensuring that citizens of their country have good access to health and their well-being on the plate for each of their respective governments. CTAP as a project has been able to run for 2 years consecutively, and we are still running the project. And basically, the main approaches that we've used that has really helped us so far so good. Number one, it has been coalitions, right? Because we understood that it's important that people buy into our message, thereby creating coalitions that would ensure that people are understanding and willing to participate in the message we're trying to pass. That's number one. Number two has been through community-based organizations. We understood that when we talk about vaccine equity, vaccine hesitance, it's important to penetrate into the difficult terrains across Africa. And as we know, I mean, it's a common knowledge that Africa is quite large, and we have very deep remote areas. And in these remote areas, we also have organizations who have been running in the communities, right? Who were necessary for us to be our launch pad in these places because it was important for us to get the message across to this public. Then also we've been using technology, basically ensuring that our message doesn't just stay in our hard drives. We've been using digital technologies and social media technologies, basically to also rally around the message that we are passing to get them across to the needed demography because we understood that there was also a demography online that we needed to pass our message across. We also have a very wonderful website, by the way, which is covidfund.africa, where you can get access to all the research work that we've done, all our community engagement, all our community interactions, and also all our coalitions that we have built. All the representative of the work or representations of the work that we have done are all on the website. Also, in our approach, we also understood the approach of engaging government because we understood that as society organizations, we can only advocate for solutions to be embraced. Right? It was important for us to get to the table relevant authorities, relevant stakeholders, which we believe that they were very pivotal to ensuring that some of the policies that we were advocating from the result of our work were implemented in these countries. Yes, some of them have been very slow, while some of them have been fast in ensuring that these policies are, accepted, are also engaged and used in these countries because we understood that for us to get the kind of impact of the work that we're doing, we needed the buy-in of the government agencies and other relevant stakeholders. And the last approach we've also used, it's the approach of ensuring that in these countries we have volunteers who are very volunteers who understand the essence of the work that we're doing, and who also volunteer their time, their resources, and their own understanding to ensure that the messages were passed across in communities, hard to reach communities, and underserved communities. Also, we didn't forget the place of media, right? Because we understood that for us, it's important we get the media on board with us so that we can get the coverage we need for our work. These are many more the approaches that we've used for the COVID-19 transparency and accountability project across Africa. Thank you.
Great, Iyanu. Thank you for those points. I'm just gonna now give the word to Mukhtar so he can talk to us a little bit about the achievements of the project and the impact that we have had.
My name is Mukhtar Modibbo. I'm the Secretary General of Follow the Money and CTAP lead from the Connected Development side. Over time, for the past 2.5 years, we've been implementing CTAP, and at the course of our implementation, we've encountered a lot of challenges and we've encountered a lot of achievement, which I'm going to discuss with you across the countries. As you know, we've been running CTAP across 9 African countries, and over time, the achievement has always been, massive, and what we always look forward to, from rising citizen voice to demand accountability around health sector accountability, which we've achieved that in numerous places around discussion of the open government partnership for countries that are signed up to the open government partnership. And for countries that are not signed up to the open government partnership, we try to create what is called health sector coalition. It's a coalition of civil society as well as government and other individuals to come together and discuss about issues of health sector accountability. For the open government partnership countries, we tried as much as possible to see the countries having to inculcate health sector accountability into their service delivery of their countries. And we also have input of demanding changes in health policy and practice across these countries, where we tried some partnership between civil society and government to have that improved service delivery policy around health, as well as practice of the health sector in the country. That has been achieved, and like I said, we leverage on the OGP for that impact, and we also have had issues where demanding change from people, not just us from the civil society organization, but from people across the country, has been our major achievement, where we were able to get government of Cameroon to the Ministry of Public Health to sign an agreement with us, as well as in Malawi, in Zimbabwe, and in Ghana. We've also had an achievement where we were able to track spendings of government across these countries, from Cameroon, Nigeria, Malawi, Kenya, Senegal, and some other part of the countries that we're doing. Then citizen raising voice across local needs of accountability gaps is something we try to address, and is something we have seen as an achievement in at the course of implementation of CTAP.
So thank you, Mukhtar. Those points and those achievements have been great. And also building on what Iyanu said, it's important to know that it has been the work of a group, the work of coalitions in the different countries that are pushing things forward. So it's really, really the work of our partners in Nigeria, Ghana, Kenya, Cameroon, Malawi, Sierra Leone, Liberia, Senegal, and Zimbabwe that has made this and all the achievements a reality. They have been able to build really a movement that started with having 100 organizations in the whole network, and now it's almost tripled, getting to more than 300 organizations. And it's really important to know that it has been a concerted effort and a strategy to increase our network, but being really, really aware of the need to engage the government. And it's important to know that we move from having 7 governments in the network to now working with than 80 government agencies in the whole project across the countries, and also an effort to reach out to the communities, the local people that it's really suffering many of the challenges that come from weaknesses in health systems. And in that case, we also moved like from having 10 local organizations in the group to now having more than 100. So it's been a really incredible work by all the country partners. Um, but now with that, I just want to get back to you, Iyanu. Are there any lessons that you will highlight from this project, or any things that are really informing the work that you guys and the country partners do?
All right, so thank you very much, Oye. And the lessons I mean, we had a lot of lessons, and basically, number one was that we needed to ensure continuous investment in our own selves for the quality of the work to remain excellent, right? So, I mean, for the quality of the work we want to see, we have to continuously invest in our country partners and our community-based society, community-based organizations. I mean, that also formed part of the activities that we would, look into in the near future, which is training, training community-based organizations and training country leaders, who represent the project in their countries. That was the first lesson for us. The second lesson for us basically was also understanding, how neglected the investment, or let me say, how low the investment in health across Africa has been. You know, one would have thought that after the Abuja Declaration, which states that 15% of every country budget, every African country's budget, who were part of that Abuja Declaration, uh, would be 15% dedicated to the health of the country. One would have thought that African countries are even going above this particular percentage. I mean, it was a shock to eventually realize that the highest, I mean, the country that is scratching it on the highest level is not even doing 15%. It's doing just 11%, right? So when you look at all these things, those were big lessons for us to continuously advocate for investment in health, and to ensure that there's a global standard which health providers are adhering to, and also a global standard to which the provision of healthcare access, which Nigerians, Ghanaians, Zimbabweans, Sierra Leoneans, Liberians, are having opportunity to access. Right, so that's another big lesson for us. I mean, another lesson that really stood out for us was the importance of the gap that that has been in existence in the national action plans for countries that already sign up to the OGP process, right? The gaps which where we didn't see the necessity for health sector accountability in their national action plans, right? And what we've also done, and what that gave opportunity for, was to also advocate for inclusion of health sector accountability in their national action plans, right? And just like Mukhtar said, for countries where we didn't have the open government partnerships, we also created, we engaged with community groups, which also serves like a pressure groups to go in the country, where the government always look forward to whatever message they release in those groups, right? Because it's a coalition of very strong and powerful persons who work in different respective walks of life in this country. So for us, all these things I've mentioned, I mean, there are other lessons that we also picked, across the work that we've done. If we continue, I mean, I can speak on the lessons for the next 1 hour, right? But I just wanted to highlight, the ones that really stood out for us in the whole project as it stands. Thank you.
Thank you, Janu. And those lessons are really interesting and something that will really inform what comes next for the project and for the work by all the country partners, uh, and us in general. But yeah, with that, we can go to Mukhtar. Mukhtar, can you tell us a little bit more about what's next for CTAP?
Like I said earlier, we've been running CTAP for the last 2.5 year, 2 year, 5 months now, or 6 months presently. What we want to achieve next step for us is to increase more regional footprint and influence. We want to have more influence, and then we want to activate more countries into CTAP so that we can have a unified health sector accountability across this country. And the second thing we want to do is we want to develop and share more innovative approach in improving health service delivery, which is going to be a plus for this part of the world to have a well-defined approach for the health sector accountability as well as the delivery of health sector. And we will also want to strengthen the use of system approach, right? System approach and boosting the health system. Now we want to, see how we can use our research, our knowledge of other part of the country to, how we can strengthen the system. And the fourth part of this, we want to double down collaboration with government agencies. We've started collaborating with government agencies, like in Nigeria, we have a collaboration with Servicom, we have collaboration with National Primary Healthcare Development Agency. In Cameroon, we have a collaboration with Ministry of Public Health. In Zimbabwe, in Malawi, we have collaboration with the Malawian Human Rights Commission. In Zimbabwe, we're doing with Transparency International as well as Zim Code and what have you. In other countries, we've had collaboration with governments, and we want to try that collaboration to get more collaboration with government agencies so that we can achieve our aim. And after that, we want to double, like I said, we want to test communication and strategy for advocacy as well as citizen mobilization. More of like have more people be part of what we're doing. We want to mobilize more citizens, and we want to double our strategy in communication, having to put our communications out there from getting more people, decentralizing our information, and mobilizing more people to do what we're doing. And also, we'll be strengthening relationship and collaboration between us and organizations that are youth groups, women, and people living with disability groups is something we want to do more. And then, lastly, we want to we want to do more on the strengthening of peer learning and collaboration, peer-to-peer learning from countries we're working and countries we're not working, to just rub minds together and see what works in this country and what doesn't work in the other country, and see how we can, put them together and work together. That is what is for us, next step for us as CTAP countries. Thank you.
Thank you, Mukhtar. That's a really exciting future for CTAP. Iyanu, do you have any other points to add maybe on those next steps or any other relevant ideas about the project that you want to share?
Yeah, thank you very much, Oye. And I mean, Mumtaz, said it all. And basically, we are, I mean, in addition to that, next steps for us is to ensure that we are able to cover a lot of grounds with communications and campaigns, right? Communications, campaigns, advocacies, right? And the reason for this is because we've seen a lot of insight from the work that we've done. We've seen a lot of, results from the research that we've carried out across these countries, and we feel the only way we can measure impact is if we are able to get those things done. I mean, we can't do them by ourselves, but I mean, there's a window of opportunity for advocacy and also for more future collaborations. Yeah.
It has been an amazing time with you, listeners, and without you, we cannot achieve what we want to achieve. CTAP is here to stay, like COVID is here to stay. We want to get more impact. We want you to join us in this journey of activating transparency and accountability and creating robust system of health sector accountability. Let's do that together with you guys. Thank you.
Thank you, Jan. Well, and I think that's it for us right now. And I will just invite people to read the report that will be available in COVID fund.africa and in Global Integrity's website too. And stay tuned for more to come from CTAP. Thank you all.